హలో ఆల్, వెల్కమ్ టు RTV. నేను మీ కౌసల్య. ఈరోజు మనతో పాటు క్లినికల్ హెమటాలజిస్ట్ డాక్టర్ యోగలక్ష్మి గారు ఉన్నారు. తనతో మాట్లాడి హెమటాలజీ గురించి మరిన్ని విషయాలు మనం తెలుసుకుందాం. నమస్తే మ్యామ్, హౌ ఆర్ యూ?
Fine.
యా, వాట్ ఈస్ దిస్ హెమటాలజిస్ట్? వాట్ ఈస్ ఇట్ అబౌట్?
Yeah, hematology is a field where everyone doesn't know what is hematology actually. Hematology is something to do with the blood. And we as clinical hematologists, we treat some diseases of the blood.
Okay.
Either it can be some benign disorders, that is there can be some problems of hemoglobin, there can be problems of platelets, there can be problems of white blood cells.
Okay.
And apart from that, there are blood cancers, some cancers called lymphomas and myelomas. We deal all with these cancers.
Okay.
Basically we treat the patients with these problems, and also we are specialized in to do transplantation, especially bone marrow transplantation.
Okay.
And something called a stem cell transplantation, which is also an advanced version of bone marrow transplantation.
These days we are seeing many people are affected with anemia. I mean hemoglobin, loss of hemoglobin, or what we can call. Yeah, how it can be treated, I mean prevented or not?
Yeah, surely anemia can be prevented. There are many types of anemia.
Yeah.
Anemia there can be because of nutritional deficiency.
Okay.
Like we don't take proper iron, we don't take proper vitamin B12, like folic acid. These are all something which is present in the foodstuffs which help to build hemoglobin.
Okay.
So we can prevent such kind of anemias.
Okay.
If we are taking a proper food which is rich in iron, especially pregnant women and growing children, and also menstruating women, they require lot of iron.
Okay.
So iron can be present in some foodstuffs like non-veg, and also apart from non-veg, vegetarian foods like green leafy vegetables, and also in something called dates, your resins, all those things have iron. So
Okay.
iron rich foods if you are taking, that can prevent iron deficiency anemia.
Okay.
Whereas some anemias like aplastic anemia, that all is occurring by nature.
Okay.
With some problems, some bone marrow problems, those kind of anemias is difficult to prevent.
Okay. So if one child has a thalassemia major, if for the second child that can be prevented?
Yeah, you can prevent. Like now actually the guideline says all pregnant women should be screened whether they have a thalassemia gene or not.
Okay.
Not at least gene level, you have some blood test called HPLC, where you can find that this woman who is pregnant may be a carrier of thalassemia. Thalassemia is a genetic disease.
Okay.
So thalassemia comes from genes when both the genes are affected.
Okay.
Every person in the world has two genes for every trait.
Yeah.
Like every feature in the body, we have some two genes in the DNA. But sometimes these two genes also, if it is affected, then thalassemia can occur.
Okay.
Whereas if carriers, in case of carriers, only one of the gene will be affected.
Okay.
One of the gene which produces hemoglobin, like beta gene we say, sometimes alpha gene, that will be affected. Okay. If one of the gene is affected, we call them carrier or trait. And if both the genes are affected, they will have the disease.
Okay.
So this thalassemia can be prevented if you have already one child with thalassemia. For the second child at least, when the woman is pregnant itself, we have to see whether the baby inside the mother's uterus is affected with thalassemia or not. That can be seen by taking some tests called chorionic villus sampling.
Okay.
That will be done in first 3 months. So if at all the baby is affected, then we can go for options like abortions if they are willing. Other than that, if it is not a natural conception, if it is only in vitro fertilization,
Okay.
like that all you might have heard,
Yeah.
artificial fertilizations. So in those cases, even before implanting that embryo inside the uterus, you can check whether that embryo is affected or not. Okay. And then we can prevent those pregnancies. Only healthy embryo we will just implant inside the uterus.
Okay. So these days we also heard about this blood cancer and all, and previously it's also there. But what are the causes of blood cancer? Is there any?
Actually, till now there are no causes found for blood cancer. Blood cancer occurs when usually our red blood cells, white blood cells, platelets, these are all present in the blood, and these come from the mother cells called stem cells, and that stem cells are present in the bone marrow. And bone marrow stem cells, when they get affected with some hit, it can be something like radiation, it can be something like some medicines or drugs. So if it gets some mutations in those things, that can change into a cancer. So that is one of the reason. But why this, which medicine will cause, we have only certain chemotherapy agents can cause cancers, but it is very rare. Not all the cancers are explained by those things. Some cancers can be inherited. In blood cancer, it is very rare to have an inherited type of cancer. But usually in other cancers, there are many inherited varieties like breast cancer, ovarian cancer, like that. But in blood cancers, those kind of preventable causes are very less.
Okay, so what would be the symptoms of these, blood cancer? What would be the symptoms?
Usually when the blood gets formed from the bone marrow, that stem cells are forming all the three kinds of blood cells. When the stem cells get affected, they become cancerous cells. So these cancerous cells will multiply at a higher rate than the normal cells. So when these cancerous cells proliferate, they fill the bone marrow. There is no place for the normal cells to be produced. So when they fill the bone marrow, when the cells which are coming outside the bone marrow to the blood are less, you can have anemia, you can have low platelet count. So all these will cause some fatigue, weakness. When you are walking for some distance, there will be some breathlessness. And if platelets are reduced, then there can be bleeding spots, especially in the skin and also from the gums, like that it can bleed. And next thing is WBCs, when they are not in an adequate quantity, like adequate quantity also, and if they are excess also, but not good WBCs are there, it's only cancer cells are there, then it cannot fight, the body cannot fight against the infections, and there can be fevers, prolonged fevers, not explainable. You cannot find the cause of the fever. So these are all the symptoms of the blood cancers.
If a baby's umbilical cord has stem cells, right? If we preserve them, can we use them for further?
Usually there is a misconception that we can use further. You can use only in certain types of diseases. Like if you are storing the umbilical cord blood, it has lot of stem cells, but the quantity of stem cells which are there for an adult, if one adult like father or mother is affected with the blood cancer, and the baby's blood, umbilical cord blood has been preserved already, this mother and father's weight will be so much that this one umbilical cord unit will not be enough to support the stem cells required for them in case of future stem cell transplantation. But this umbilical cord cells can be useful for some pediatric population, like some children, say within 5 years, within 6 years, if at all they require bone marrow transplantation for anything, that time we can use. But usually for a common public, for an adult person, 1 unit of umbilical cord is not that much useful. So commercially speaking, many people are promoting umbilical cord blood to be stored, but umbilical cord stem cells can be stored if it is a kind of public banking. Like I can use my umbilical cord stem cells to anyone, I can donate. If it is like that, then it will be okay. But some registries are made for those things, but we don't have that system in India. So mostly this umbilical cord storage will be not that useful.
So in blood, in blood checkup, we have been seeing this IPT something. ITP levels. What is this ITP?
ITP is one of the disease where platelets will be getting destroyed in our own body. Our own platelets will be getting destroyed in our own body. So it will come outside the bone marrow, the platelets will come into the blood, but it will be destroyed in some organs like spleen. So platelet count will be getting lowered. Even if you transfuse platelets, that also will be getting destroyed. There will be some antibodies formed against the platelets, which will be which will cause destruction of the platelets.
Is there cure for that?
There are some medicines. You can like ITP is a self-limiting disease which can be cured in children most of the time. Like 60% of children have cure rates.
Okay.
But whereas in adults only some 20 to 40% will be getting cured with ITP. All others will turn into something called chronic ITP. Chronic ITP means this kind of low platelets will be persisting for more than 1 year.
Okay.
Almost 12 months they have, more than 12 months they will be having this problem, and in those patients the platelet may improve at some time, and again if there is some triggers like fevers or something, then it can again come down.
Okay.
So there are some medicines which can control the disease, but not 100% curative therapy is not there.
Is there any case that any foods can increase this platelet count in ITP?
Yeah, there is a myth that there are many foodstuffs like kiwi, goat milk,
Okay.
and some papaya leaf and papaya leaf extracts.
Okay.
These all will be increasing the platelet count. But actually speaking, there is no studies, there is no research fully that these kind of foodstuffs will increase the platelet. But one thing is, they can try all these things. Nothing has a side effect. Goat milk will not cause any problem to the patient. Papaya leaf will not cause any problem. And same kiwi also will not cause some problem.
Yeah.
They can try. We ask our patients to try if they want, but it never increases. We have not seen any cases where the platelet has
increase the
increased with
platelets,
these
okay.
foodstuffs.
So is there is any cure for that, for long term cure? There is no
There is no long-term cure for ITP, but in case of some diseases like dengue where the platelet counts come down, it is only transient. It will improve after some time.
Just assume that if my grandfather has this CLL,
Okay.
if he diagnosed since last 3 months, what if he has taken any, I mean, if hasn't taken any treatments?
Okay.
So what would be the process, and how when we can take the further treatment?
Okay. CLL is a kind of blood cancer,
Okay.
and we say chronic lymphocytic leukemia, where there will be a lot of WBCs in the blood, lymphocytes. It can go more than 1 lakh, it can go more than 2 lakhs, like that also.
Okay.
But usually all CLL patients will not require treatment. Only certain stages of CLL where platelet count is coming down, anemia is there, and it is not controlled with any other medicines like steroids initially they give, so it's not controlled with that. Or if the patient is having weight loss, unexplained fevers, so this all are some symptoms where we have to start treatment in CLL. Other than that, only with the WBC count, we are not starting the treatment.
In blood cancer treatment, you used to do bone marrow transplantation.
Yeah.
So how do you do that?
Bone marrow transplant is usually done. First of all, we give some chemotherapy to the patient. So we have 2 types of transplant basically: autologous bone marrow transplant and allogenous bone marrow transplant.
Okay.
In autologous transplant, patient's own cells are given to the patient. So own stem cells are taken. Patient will be given some chemotherapy so that any residual disease, any residual blood cancer cells which are there in the bone marrow will be getting destroyed, and then patient's stem cells will be reinfused to the patient. So that is called autologous bone marrow transplant. It is usually done in some diseases like multiple myeloma, and sometimes lymphomas. Lymphomas which have recurred. First time chemotherapy, they have got cured after that. Again, second time when the disease comes, we call it as relapse. So in those relapsed lymphomas, we do autologous bone marrow transplant. Whereas in case of allogenous bone marrow transplant, it is something like one donor will be donating the blood cells, stem cells, and that stem cells are given to the patient. Patient will be given some chemotherapy which is called as conditioning regimen,
Okay.
and after that patient's bad stem cells will be destroyed. bone marrow stem cells will be destroyed in the patient, and then the good stem cells which are there from the donor, that will be given to the patient.
Okay.
So bone marrow transplant is basically done like this. It is not like other transplants where you need a surgery.
Okay.
It's not like that.
Is there any difficulty in this, or is there any side effects after this?
Bone marrow transplant is curative for many cancers.
Okay.
So after bone marrow transplant, there can be some problems called GVHD, like graft versus host disease, like that. We have medicines to control all those things, and bone marrow transplant also has a risk that the disease can come back later in life in very few cases.
Okay.
Not everyone, but there are side effects with bone marrow transplantation which should be managed by a transplant physician.
Okay. You said that in the process of treatment, you take the stem cells from the same person.
Yeah.
So what if you are taking these stem cells from the different person, like donor?
Yeah.
Is there any difficulties with them?
Usually donors don't get any difficulty. We give some injections for the donors to bring the stem cells from the bone marrow to the blood, so that it will be easy to collect from the blood. So those injections can cause some minor side effects like body pain, like that, but that can be managed with some medicines, painkillers, like that, and usually donor will not have much problem.
Okay. So what
Usually
are
it is safe procedure for a donor.
Okay. So what are the things that you what are the things that you will take that I don't know how to ask you this question. So what are the things that you consider while you are taking the donor, like while you are taking the donor to give
For
this for donating transplantation?
Okay.
What are the things that you will mainly observe or you will consider?
Okay. One thing is whether the donor is fit physically, that we have to see. He should not have any cardiac problems, any renal problem, liver problem, where it can affect his health. Okay, so that should be ruled out first. And second thing, before we are selecting a person as a donor, there is something called HLA matching. HLA matching is like how you match the blood group.
Okay.
A positive with A positive, like that for transfusion. For stem cells, we see something called HLA matching, and that is done for the patient and the donor. If they are fully matched, we take.
Okay.
Nowadays, the techniques have improved that even if a related person is there, and if 50% of genes are matching in HLA genes, then we can take them, and we call it as haploidentical donor.
Okay. Okay.
And apart from that, we do some blood tests where CMV infections are there or not,
Okay.
and any other HIV, HPSAG or HCV infection is there or not in the donor, and then we choose the donor.
Okay. Thank you so much. You gave a lot of information to us, and thank you so much.
Yeah, thank you.
Thank you.